Get it started.
Okay, that's recording for you there, Anne.
Lovely. Okay, hi everybody and happy Monday. And thanks, Seamus, for giving me a slot on your Ireland Together. And it's brilliant that you're doing a whole focus on in March for men's health. So just to get started, you see a picture there with three burly men dancing. That's actually a photograph from a project I did a few years ago with Gutbusters in Dublin Bus. And those three guys are bus drivers from Cunningham Road Garage. And part of this wellbeing initiative, there was 4 parts to it. There was a part around gym work, walking, and dance. Dance was a big element in it. And I collaborated with a community dance director. Her name was Philippa Donlan, and she's an amazing lady, and she believes we all can dance. But I remember the first, we managed to recruit 30 drivers into this session, and they had dance practice every week. But I remember the first session, they all were telling her they all had bad hips, bad knees, and one, 2 left feet and so on. And they kept focusing on their disabilities. So she kind of turned around and said, well, if your right arm works, we'll just use that, But by the end of it, she had them all dancing and they lost a lot of weight. And they put on a show. This was taken in the Tivoli Theatre. And we also celebrated the best weight loss and so on. And I remember that year, Clontarf actually their garage lost 13 stone. They lost a man. So the idea was to lose a man in every garage. But it was a great initiative and they really enjoyed it and it was great fun. So I just have a quote here: engagement is the dynamic process of sharing and connecting with men to achieve better health. So if we can do it in a way that there's a bit of crack, and that and in the audience that night there was all their families, their spouses, friends, and they also did it for charity. They did it for Temple Street Hospital. So there was a really good feeling in the house that night. So it's to kind of harness some of those things and bring them into your own well-being practice for men is something we'll chat about. So what I'm going to talk about is around the background to men's health care and workplaces, and how workplace plays a massive role influencing men to get more active about and proactive about their own health. And just what are the barriers for men? What actually stops men from engaging? And then the rules of engagement. I'm part of the Men's Development Network and they develop these rules of engagement. And also just what are the main health issues concerning men to consider when you're implementing a wellbeing program, and just what works and what's the future, and a bit around resources. So feel free to stop me and ask any questions you may have. So in 2008, the Irish government launched the first men's health policy in the world. We are actually leaders in this whole area, and we're very lucky to have a group of very enthusiastic academics and stakeholders that are very passionate about men's health. So this policy was set up, I suppose, regarding a lot of concern around men's mortality rates in Ireland. And at that time, there was a 5-year gap between men and women. So men were dying 5 years younger with a lot of lifestyle issues that are generally preventable. So they questioned this, and there was lots of recommendations from this policy. And one of the recommendations was building capacity and focusing on areas such as education and how can we engage men into training, into health. So in 2013, the Men's Engage Men's Health Programme was initiated, and I was one of the early facilitators on this. And this programme was aimed at people that would have a lot of interaction with men. So the workplace was one setting, communities were another setting. And to date, I've ran about 20 of these workshops between Bus Air and Irish Rail and Dublin Bus. And the people I've targeted are, say, trainers, safety reps, unions, supervisors. These are men that would interact with a lot of other men and would be key influencers in getting men to participate in future programs. The Engage program has grown substantially since 2013, and the last program I did with them was just before COVID broke, was the middle-aged men program, because they've seen the middle-aged men as actually more susceptible to mental health problems and lifestyle. So they kind of geared a program towards them. They also did another program around young men, and now they're actually working on engaging farmers. So it's really, if you get a chance to become a facilitator, it's really well worth it. Then from that, in 2016, Healthy Ireland had a focus on men and a gendered approach for men's health in workplaces. They've seen the workplace as a key setting for delivering men's health initiatives. And then the National Men's Action Plan had a healthy workplace framework with a piece around men's health on that. So all of this is actually happening in the background with lots of evidence to support it, why the workplace is a key area.
And Anne, just a quick question there. Was there a particular focus on mental, physical, or both? Or was there anything of prominence through the whole research and work?
Well, I suppose around the Engage training, the mental health piece was massive, because I suppose they realise if a man is in poor mental health, they generally their self-care deteriorates. They medicate with alcohol, you know, like us all, you know, if upstairs isn't working, you know, so the prominence initially was around mental health.
Okay.
So, and then the physical aspects came after that. So the masculinity piece is really important because society, I suppose, traditionally has constructed men to be very stoic, strong, and, you know, I suppose being vulnerable for a man would be seen as a weakness, and to even express issues around their mental health with other men would be a kind of a big step for them to go. So they suffer in silence. And I suppose it's interesting, traditionally with say our health services, men have been in charge and leading the way, but there's like, for the majority of men, there's a lot of silence around issues around mental health. And, you know, this is around how masculinity is constructed, and it's not serving men. So I think, you know, there is a new wave. Younger men are talking in forums, but I know myself in our cohort of men, the demographics are generally 45 towards retirement. So there's still a lot of stigma around mental health in our workplaces. I know for a fact, I know of one man I've worked with who has suffered with depression, but he generally takes sick leave when he's very depressed. So he's still masking it. He's, you know, it's where the masks of masculinity. So what's in front of the mask and what's behind the mask, there's a massive deficit that we have to try and probably take the stigma around, you know, mental health in workplaces. We still have a long way to go. So the workplace is a key setting for delivering men's health initiatives. And this is from Noel Richardson, who's a key academic. He's from Waterford, but he's on a world scale. He's leading the way around men's health. You know, so he's a strong advocate. And this quote was taken from the document on middle-aged men and suicide. So 4 times more men are likely to die of suicide than women. And I, you know, over the years, I would have known people I've worked with that have died. So I suppose that it's frightening to think about the stats now that are going to happen from last year. You know, I'd say it's on its up. So I think we all have a role to play in influencing our male colleagues and helping them. So corporate wellness and male engagement, a company called Optum, it's a health service company in 2014, did some research, and they found women are more likely than men to take part in workplace health screenings, weight management, health coaching, and web-based programs through their employer than men. So men are more likely to get flu shots at work. So we every year we run a vaccine program right throughout the country, and we have great uptake from the men because it's kind of, you know, they want to stay at work and they want to be well to going to work, but and are also more likely to participate in smoking cessation programs. So they're good hooks to get men involved initially. 40% of men responded that their families prompted them to participate, go to the GP or participate in wellbeing programs. So I know I've learned that from the past. I remember with the Gutbuster programs, I would encourage the men to bring their spouses in to attend any wellbeing initiatives, you know, or talks we had. And more recently, Siobhan D, she's a researcher on drivers and diabetes, and there's big evidence that drivers are 50% more likely to get type 2 diabetes. So we're in a planning stage to run a big research program with drivers that has a whole health coaching element in it, but it will also have an aspect that brings in families. So I would really advocate that if you want to get men involved, get their spouses involved as well. And, you know, that has really worked well for me in the past. So the Healthy Ireland survey in 2019 have noticed that 24% of men smoke versus 21% of women, and over alcohol consumption and frequency of binge drinking is higher in men than in women. So men will self-medicate with alcohol, and there's just, I suppose, naturally in the country we live in, there's a real acceptance of heavy drinking and binge drinking. Also, men's diets are less healthy than women's diets. And I suppose when I think back when I was going to school, I did home economics in school. I learned the basics of cooking, whereas, you know, some men just don't have those basic skills. And the Men's Development Network and the men's sheds are looking at those skills as really important for men's health. So, you know, men being able to understand the basics of nutrition and understand how to cook in a healthy way is a very important skill for longevity. And also overweight and obesity. In the latest stats in Ireland, just the most recent one, is 70% of men are overweight and obese. And we even have a higher cohort in our drivers. We had a program in Dublin Bus that was nearly up to 80% of drivers. So that's frightening. And it's interesting when the drivers start in the company, they're given a uniform and they say it's too big for them, but the fella in the uniform office says, "Oh, you'll grow into that." You know, there's nearly like an acceptance. But, you know, the general population, we have 7 out of 10 men overweight and obese. And this is attributing to a lot of lifestyle disorders. And I suppose in our company, we've issues around fitness to drive and, you know, things like sleep apnea and diabetes. All of this, you know, can affect their performance and work. So, you know, we have, it's a challenge.
Just a quick question on that, Anne, as well, as we're on about alcohol, and the last year the pubs are closed and all sorts of stuff. Are you seeing any follow through on that as regards? And it might be too early, but do you have consumption of alcohol and consumption and consumption trends, or is that do you have even any insights or even anecdotal insights on how that's impacting your staff?
Well, there's a lot of silent. Well, you know, we're actually about to do a needs assessment with Irish Rail. We have a new wellbeing manager, and you know, we have drug and alcohol programs, and we would have random testing going on all the time. So they wouldn't discuss it openly.
Yeah.
But there is that fear of being randomly tested, and they, you know, being positive for alcohol, they would be taken down. So I suppose our workplace has that, you know, that other layer of, I suppose they have to really watch their drinking habits.
Right.
If they're working the next day, and they're very aware of, you know, if they have 10 pints, they nearly need 10 hours, you know, they need a long time in between start driving a bus or a train, that they would be safe.
Yeah, and do you think with the tap being switched off, let's say, and I'm sorry about the pun, but is that affecting, do you think, just not just like maybe there's evidence within Irish Rail or Bus Éireann or any of the companies you're involved with, but do you think broadly that maybe is one positive, maybe, that people are
Yeah,
reducing?
I've heard of someone, like I know a man, myself that just drank in pubs, but he's not drinking anything at all. I'm actually help coaching a train driver at the moment that he only ever drank in the pub and he doesn't drink at home. So he hasn't drank, which is positive. So I'm just working with him around weight loss, and he's down nearly 3 stone, but definitely not drinking alcohol at the moment is a big advantage for him. Because I think when you drink alcohol, it leads to the takeaways, it leads to, inactivity the next day. It has massive implications.
Yeah, it'd be interesting to see how that pans out. Yeah, thanks.
Yeah. Sorry, I don't have details on it. So this is just another infographic just on men's health facts. So men live 4.4 years less than women, and we're talking about equality in society. If I just seen that fact for the first time and I was a man, I think I'd be pissed off, because I'd rather, I feel I'm as entitled to live as long as women. But we do have to question society and, what's going on for men, that there's this massive gap around mortality. And generally for men, the last 11 years will be in poor health. So generally, like I notice, I used to work in IBM, and it was a much younger demographic to Irish Rail. And what shocked me most between the 3 companies, all the notifications around funerals post-retirement. These men, they work so hard. They work kind of the traditionally they would have done 7 days a week and lots of overtime, but they neglected their health. They kind of didn't think about it. And then once retirement came, I suppose their mental health would have deteriorated, and some lifestyle stuff as well. But there was just, I noticed a lot more funerals just around after retirement, and that kind of made me sad. So, men are more likely to die from heart disease and suffer with pancreas problems, and also spinal injuries. 80% of young men, attributed to spinal. So this is probably high risk behavior. And also around suicides, they're higher cohort. So 56% of men make up the workforce, but 94% of all workplace fatalities are men. And I suppose they go into the higher risk industries like fishing, farming, construction. So you're going to work for some men is a high risk factor. A friend of mine, actually, he worked in the buildings, and about 20 years ago, he was hit by a boom, and he fractured his back in 3 places. And to this day, he still hasn't gone back to work. He's kind of approaching 60 now, but it's, you don't expect to go to work. As a woman, I wouldn't expect to go to work and come back and break my back in 3 places, so it's just, for men, there is higher risk in that area. So the top 3 reasons for reduced lifespan in men is cardiovascular disease, suicide, and motor crashes. And they say a lot of those single car accidents at night are due to suicide as well. That can, the stats don't clearly show that, but they suspect that. And also then globally, alcohol kills almost 6 times more men than women. So men would self-medicate using alcohol to dumb down emotional pain, and whereas women are much, would interact and share or use the EAP programs a lot more easily. Men are very slow to share that they've rang a counsellor. So these are, it's just the macho culture and its impacts. So, what are the barriers? What is holding men back? I just thought this was an interesting graph. It was done in the UK, and it shows men and women at different times in their life, either they're full-time, part-time, full-time student, unemployed, or retired. But you notice for the full-time, only 37% of men visit a GP in the last 3 months versus 53%. And you see, actually, the numbers are lower right through until retirement. So it becomes equal nearly at retirement for men and women. So there is something in that around, women find it easier to access, or maybe women are in more flexible working arrangements, or that they can get to a GP. But for men, for most of their life, it's a challenge for them to access a GP. And I generally find men go in a they get the problem and they go in a reactive state to see their GP, whereas women, I suppose, naturally would be interacting around getting contraception, or with their children, or looking for vaccines, or for their kids. So women would be developing a rapport with their GP throughout their life, whereas for men, it's kind of it's an uncomfortable, when they do eventually get to the GP, they're not that comfortable in going. I remember I grew up with, my mum was a public health nurse in the country, and we used to call our sitting room the clinic. And I remember there was a local mechanic came knocking on the door, and his finger was falling off. And it was like, instead of just going to the A&E or his GP, he would come and see my mother, because that was less stressful. But we just grew up with lots of people calling, but it was men were slower, it was a last resort to go to a GP. So we have to try and change some of that mindset. But this survey was done in 2016, so it still shows a big limitation. So just other barriers, like the work demands, I suppose men are, considered the provider in the family. And although that's changing now because more women are working, but traditionally, I suppose, in the cohort of men I work with, the woman stayed at home and minded the children, and the men did as much overtime as they could. The masculinity stereotype, I'm a strong, I don't get sick, and sleeping is for wimps, or like all of those kind of phrases, and just generally no time, or maybe the surgery times didn't suit some men. Men's needs not addressed in some wellbeing programs, and then lack of trust. We find that's a barrier at the moment within our organisation. Just kind of fearful of them being taken down from driving if it's discovered they have high blood pressure, or they're on, they have addiction problems or whatever. So, and then fear, or dying of embarrassment. We would have a lot of older men maybe with prostate problems, and, the fear of having a rectal examination or having a blood done or anything like that would maybe hold them back. So these are all things to consider.
Sorry, Anne, class.
Yeah.
Go ahead, Jen.
Go ahead, Owen. You go first.
Are you sure? Ladies first. Come on. I look bad.
We're talking about men here. But sure, I just wanted to ask, when you talk about that feeling of, they may not want to participate, or they're kind of afraid of being found out, how do you manage that in programs when you talk about drug or alcohol problems? Because there is that difficulty, obviously, when it's found in the workplace, that, especially when driving, they wouldn't be able to drive. So how do you manage that in a safe way for them?
Well, we run a lot of awareness workshops around drugs and alcohol, and I suppose it's they like the three companies I work for, safety is of paramount, and I suppose we talk about health and safety. So like the three companies have been very good with the safety aspect of things, but now we're trying to bring in the health. We're trying to kind of get the health and safety on an even par. And each of the companies now are slowly recruiting wellbeing managers. And, I suppose it's education, and I suppose they don't want to lose their job, because some of them are the main providers in their family, and the fear of losing their job as well. But there is alcoholics out there for sure. But it's, and I think there's a lot of silence as well. And I think a lot of colleagues are covering for each other as well, a bit around that. But I think more and more now, when we do accident investigations, if someone had, a manager, if you have a colleague that is maybe has an addiction, there is, you need to report that. There's an onus to do that. But it's like, I suppose what we have employee assistance programs, so they can self-refer themselves for counselling around addiction. And, you know, I would be, when I'm out and about, I'm coaching guys, I would encourage them to be proactive around, because a lot of maybe alcohol or addiction are just symptoms of other problems, you know, the emotional stuff that's going on for them, and to kind of understand, I suppose, who they are and what's maybe driving this behavior that's not serving them, you know. But that's, if I had a magic wand, it'd be great, but it's, you know, you start, you know, I suppose, like around the rules of how you engage men in this other slide, you'll be bringing in some of these elements. But definitely, when I help coach with men, I sit down with them and I say, we're going to work collaborative, like this is a collaboration of us two together. And I always say to them, I've lots of really good information, but what you bring to the table is just as important. So it's about me giving them autonomy as well, and that they design their own wellbeing program. And I suppose I also get them to sign a contract, and the big part of my contract with them is confidentiality. And I say to them that, you know, the only way that I would break that confidentiality if I felt they were at risk to others or at risk to someone else. You know, it's, you know, under the codes of ethics. But in the collaboration, I give them the pen and we do a life wheel, and we get them from the life wheel, we get them to, you know, look at where they're at. And, you know, and I always like promote honesty. I say there's no point on us, you know, if we're not going to be honest, you know, and they volunteer to come into the service. So it's that building that rapport and building that trust and that psychological safety is really important when you are working with people, especially with addiction in the background. And, you know, that they and work from a strengths-based angle. So, you know, I ask them what they're good at. So you always start with the positive. So if they're really good at organizational skills, I said, how can your organizational skills come into your own well-being program? And I give them a folder and they take home their notes. Like traditionally, when you go into a GP writes down all your issues and he keeps your folder. So you don't own it, you're passive. Whereas, you know, my whole ethos is that to empower them, and that, you know, I say to them when they come and see me, I say, my intention is that you leave my office an inch taller, that you feel that you can deal with it. Because really, at the end of the day, we all sort out our own problems, but we have to own them, you know, and feel empowered that we can do that. So around the rules of engagement, it's key.
Sorry, Anne, if you don't mind. Yeah, just I wanted to ask a question there before.
Yeah, sure.
To my mind, it was on the last slide too.
Yeah.
Just wondering, what are the three main resistors that men have towards engaging with employee wellness programs, please? And I will go back to mute, by the way, because you might end up hearing Dora in the background here because I'm babysitting as I do things. So I'll go mute again. Thanks.
You're grand. I suppose the three, well, like I just know in my company, the three main things is there's lack of trust. I just know we did a strategy and that kind of came out around where data was going, you know, so really have to be very transparent. And I remember a few years ago we got Layla Health in to do a program with an app, and there was very little engagement, but within the feedback, they felt because it was a medical insurance company, that some of their data would kind of go into our data. And so that's, you know, that was really big learning for us. You know, who you're getting and who you're partnershiping with. So yeah, lack of trust. They have a big fear in our organization of being taken down from the driving position. So everywhere is very different. You know, you have to kind of, you need to do a needs assessment and ask them, you know, what are their barriers? Because every organization has unique stuff to them. But I just know that's for our, like, this fear, you know, they kind of want to self-manage their own health. They kind of see work and their own health as being separate, you know, so that, and another big barrier we have is IT issues. Like half our staff in Irish Rail are connected and half aren't. So the people that have work mobile phones will more than likely download an app, you know, because it's their work phone. But some of our drivers and throughout the three companies don't want to put a work app on their own personal phone. So, you know, we're looking at maybe eventually giving everybody an Android phone and educating them how to download an app. Because like not everybody is that IT savvy. I think in the last, since COVID, skills have gone up, you know, a bit, but still we would have a cohort that, yeah, you still have to have notice boards, you still have to have soft copies of things to, we're actually launching a program with Irish Rail now at the end of this month, and we have to 50% are online and the others aren't. So we have to have a two-prong approach on that. Does that help answer? So, well, they're in my experiences, but everywhere will be different. So it's key as well to think about, yeah, collaborating, having a focus group with the men before you actually initiate a wellbeing program at work, and asking them, you know, what it is they would like in the design and delivery of that. With the Gutbuster program, our logo was a fat bus, you know, with a smiley face. But the guys came up with that idea, and the marketing people in Dublin Bus ran it. So they all had pins, you know, there was about 350 participants. So they all knew who was on the Gutbuster program because they had a pin in their lapel with the logo on it. So reliable marketing and communication is really, relatable marketing communication is important. So the language you use has to appeal to men. I remember years ago I used to run stress management workshops, and I noticed was more women than men in it. But when I changed it to resilience workshops, you know, for your mental health, that kind of encouraged more to come in. And I remember another time when I was in Irish Rail, I went around all their workshops promoting a Pilates program, and I just called it core strength and conditioning workshops. And I remember the guy at the time that was showing me around, he said, "Anne, you won't get anyone interested in that." And actually 54 of them signed up, because I just kind of talked, I went to where they were at, and I just said, "How many here has back pain?" And at the time there was about 30%, but I said 80% of you will have back pain in your life, and you need to build up your scaffolding or your core strength. But I kind of talked in a language that they could relate to. And so, yeah, and then the company gave half an hour of lunchtime, and the participants gave half an hour of their time. So it was 50-50, we worked together, and they loved it. It went down really well. So having an accessible hook is really important. Either that be a free lunch, or maybe if they participate, they get a Fitbit, or there's a competition, or there's something that kind of brings them in. Male-friendly environments as well. So I know myself, if I ran a workshop in the medical department, I would have nobody would attend. But if I go actually out to their porter cabins, I go to where they are, where they actually feel comfortable, I will have much higher participant rates. And I suppose a lot of GP surgeries are more kind of suitable for women. They have women's magazines. Well, in the past, pre-COVID, there'd be posters up, and sometimes there's some posters with men in them that can be like around domestic abuse, you know, and it's very much geared more for women, but against men. So these are all kind of undertones that can make men feel uncomfortable. Definitely shoulder to shoulder for men is really like they communicate shoulder to shoulder. And it was interesting, like I have a tiny office in our medical department with no window, so I'm actually working from home. But at the start of the pandemic, I was coaching some young men. I was doing walk and talk with them, and that worked really well, because men don't really like the face to face, it's more uncomfortable. But when they talk shoulder to shoulder, they were a lot more comfortable. So, you know, these are all little things that can be brought into a wellbeing program. And with the Men's Shed, they initiate lots of projects that they work shoulder to shoulder, but also this is improving their mental health and the connection with others. So we're actually trying to take some of that, what the Men's Sheds are doing, into our own stations and work sheds as well. We have actually a driver in has started up a men's shed in Ringsend, and he's doing brilliant work, but he wants to bring some of the projects into our stations as well. Something like, you know, the sustainability gardens, the workbenches, you know, around COVID. So it's he's kind of advocating the men's sheds for our own employers, especially the ones near retirement. And a lot of men think, oh, you have to be retired to join the men's shed, and said no, there's lots of people that are in employment, so they go at the weekends. But sadly now it's not there at the moment with COVID. So experienced facilitators is really important, and it doesn't matter what gender the facilitator is, but it's around being respectful to men and you know, treating men in a positive light, you know, focusing on their strengths. I always remember, God, years ago with one of the programs I was doing at Dublin Bus, and we got an external provider to come in and do some workshops. But she said she wore mini skirts. She said, I got the legs out for the men, but oh God, that made me cringe, you know. So, you know, it was just I didn't like that. So you need to meet men where they're at, you know, make it go to where they're working. In Dublin Bus, a few years ago, I was doing a promotion around safe alcohol, and I set up a bar in each of the garages, and they were like bees to a honey pot. There was no, you know, but I was just kind of empty bottles of whiskey, and we were talking about measures and what was a safe measure. But setting it up like a bar actually brought them to you. So you have to figure out what'll work. So focus on strengths-based approach as well, like so working with our positives. So like every health coaching session I have, or every review, I always say, like, what 3 things worked well for you this week, you know, and then you kind of move to maybe the weak zones, but how can your strengths kind of support your weak elements? And then having easy access to wellbeing programs. So for us, we're working on this IT access, and you know, trying to connect with the disconnected in our companies as well, so everybody has equal access. So definitely that partnership approach is really important. So there's lots of brilliant organizations out there, and as a company, you know, like the Irish Heart Foundation, like we've linked with the Irish Cancer Society. Aware is very good. The diabetes program as well. And yeah, so there's loads of, you know, you don't have to reinvent the wheel. All the stuff is out there, and we would have the men's sheds in at different conferences over the years, and they've been really good. So yeah, so it's just and getting your own male advocates as well. In the past, I would have health coached different personalities, and I've asked them maybe to speak at safety reps conferences around mental health or around their own journey, and that goes down really well. And part of the Spectrum Health program we're running with Irish Rail, we have 5 champions. We were going to get celebs to do it, but we're getting actually our own people to talk about issues around health. So that, you know, that engages more to take an interest if they know the person that's speaking. And our own Jim Mead is very good, our own CEO in Irish Rail. He started in the company as a fitter, and he's worked his way up, but he's very open and transparent. And that he's getting conversations going around well-being. So yeah, back again, just ask them. It's really important. So a group of Canadian researchers asked a group of men, what is it that would induce engagement at work? So a key thing was finding a link between health and your work performance. And, you know, I'm always saying to guys, you know, why don't you think about retiring in optimal health? So what you do for the next 10, 15 years is preparing you for that, but also around your ability to keep at work. And, you know, a lot of the men, you know, don't want to retire early. So, you know, they don't want to get something like type 1 diabetes that could impact their ability to drive. So, you know, that's the hook to say, well, you know, if you can actually look after your health and manage your diabetes, you'll be able to work better, and you'll work safer as well. So cultivating friendly competition was also a finding they found. So definitely, and doing stuff for charity, I've noticed, like every year Irish Rail would have done the cycle for suicide, and that's massive interest, and they've collected money for that. So competition is also good at you know, getting men to participate. So definitely appealing language is important. So you can see from this poster, take control of your heart. So that's being in charge. You're the director of your own well-being, and nutrition for a strong heart. So these are just on a poster. It's worth having that kind of strong message. These are other visuals that documentation I've used over the years. The Man Manual is a fantastic booklet. It covers all the different aspects of men's health, and the Haynes manual, a lot of men would recognize that, and they would relate to it. Also for Men's Health Week, the posters, I'm part of a big stakeholder group, and I would recommend you as companies get involved in men's development, because they collaborate with everybody, and it's a collective thing. We decide what the theme is, we decide what the poster is on the poster, so that really works well with all the stakeholders. And that poster at the bottom around Men Unite Against Cancer, that's from the Irish Cancer Society. So we definitely all that kind of thing appeals. So just the Sheds for Life, just want to mention that this is part of the Men's Sheds Association, and they have a whole well-being segment that works really well. And their mission statement is to engage men to successfully facilitate meaningful discussions around their physical well-being and lifestyle choice. So they're doing really good work on this Sheds for Life aspect, and you can actually go in and look at what they're doing, and also collaborate with them as well, maybe with your company on similar stuff. So it's really important to try and take the stigma out of mental health in the workplace. Like, I know we still have a long way to go. To date in Irish Rail, we've trained 60 of our employees in mental health first aid, and that's a really good workshop. And even for myself, being a trainer, during the last summer, I had a friend that I met for a walk, and I knew he wasn't well, but I actually in the end just said, "Are you suicidal?" And he actually said, yeah, he had the rope in the boot of his car. So I just felt that course really gave me the confidence to communicate directly with a man that was feeling suicidal. But thankfully he didn't do it. He's still around. But we all have brothers, uncles, colleagues, and I think it is worth promoting that in the company. So yeah, these are, just getting topics around stress, anxiety, getting these kind of topics at safety meetings up and going, or conversations. Another really good thing to think about is a virtual Connect Cafe. Mental Health Ireland run these, but you can also facilitate them in your own workplace. But it's just a way of getting people to connect. And in the places where the blue zones in the world, connection is one of the most important pieces for our health. And so getting conversations up around these issues is very powerful. And if you can get some advocates as well internally to speak up about their own journey, allows for other men to speak up as well. So last year I did a course with Trinity. It was the first workplace wellbeing course, and we had a practical assignment. We were given a company, and we had to deal with an issue they had, and one of their issue was lack of male participant in wellbeing. They were doing loads of wellbeing stuff, but very few of the men were participating. So we actually set up a focus group with the men, and 3 areas of concern came out from that, and was around psychological safety. They didn't feel comfortable in a very female dominated scenario talking about their own mental health. And also time, they were too busy to participate, and the comms wasn't inviting. So these was just some of the components, that recommendations we made, was to continue with the quarterly focus groups, because they actually really worked, and men did really engage with each other when wellbeing, when it was set up and facilitated well. Also having a dedicated 1 or 2 hours a month specifically for well-being, and that it was done in company time. That was important. And the the comms, the communications around it did invite men, and the language was important as well. And also training champions and provide engaged training within the company was another way of getting participation. So definitely, like, you know, the terminology again is so important. So how, you know, it's important to evaluate and continuously like when you're engaging men as well. I would always get them to sign in and maybe sign an agreement or a contract. Also, it's important, say, if you're running workshops with men, that you have a group agreement and that every voice is respected, and you know, just that you're set, and that they decide what the rules are as well. So there's kind of, you're setting up the workshop that it is psychologically safe for people to discuss whatever that is, and confidentiality is also really important. And then just ongoing reviews, surveys, focus groups are really key to kind of continually evaluate. So this is just around a roadmap for the future, just things for you I would suggest your companies to get involved in, is to promote the yearly Men's Health Week. This happens every June. It's always around Father's Day, and they have a week of events and things happening. And, you know, to put some of this information on your own platforms like Yammer or WorkVivo or whatever it is. Also to send one of your representatives to join the Men's Development Network and to be part of the stakeholders, and train supervisor and managerial staff in the Engage programme, and also do a needs assessment considering the gender needs of men, and also in your wellbeing strategy as well, and try and get managers and leaders to lead by example and develop a culture of health within the organisation. And Movember, also the month of Movember, is a really good opportunity to promote men's health. So we do that every year in Irish Rail. So all of this is good stuff to you know, try and get more engagement. And just finally, just resources. The Men's Shed have a really good website called malehealth.ie. That's worth looking at. And there are lots of different websites there that you can find out more. And there's also a male advice helpline for male domestic abuse, which is a very silent subject that you don't hear much about. But they had about 6,000 calls last year. So it's a relevant topic for some men. So I think that's it. I think I've gone over, I thought it was 20 minutes. So does anyone have any questions?
And that was super. Gosh, some of those stats are just shocking. I didn't realize a lot of them were so high.
Yeah. And it's like, you know, I always think, I think men are slow. I think the Movember campaign is really good at highlighting some of that reality for men, but there's just a lot of silence around that. And I think we need to get more men talking. I always think it's really good in a workshop if I'm saying very little and the men are talking themselves. That's a lot. That's the way I'd rather it be, because they have their own solutions. And I think it's, you know, if men, they're good at fixing things, and if you can get them leading it, that I just lead from behind, and that's, you get a lot more results that way.
Yeah, I think it's coming together. Like a hashtag I use a lot is stronger together, and it means so much in everything.
Yeah.
Where you're talking about diversity, mental health, anything coming together and opening. And one thing I've seen in Ireland Together is the honesty and vulnerability that people do show in a safe environment when others are willing to talk as well. So I'm not going to speak too much here. Linda, Jennifer, Owen, Stephen, did any of you have any questions? Seamus as well.
For me, we had Frank, you know, from Men's Sheds as well, Annie, and 2 weeks ago, I think. So he mentioned about some of the work they're doing in Men's Shed, so it ties in nicely. I think some of the stuff you're doing as well, and the stuff you mentioned. I just wanted to say thanks so much. It's been a huge amount of information shared, so it's really, really worthwhile, and it's really great to see all the work you're doing in Irish Rail and how it can be leveraged and just drive awareness. I think one of the things that came through for me was language, how you position and what really resonates with males. And you know, I think you mentioned around the Pilates, for example, and refocusing that into core strength and conditioning. So I mean, that's just one example of the power of language, I think, in attracting men and engaging men. So just really want to thank you for coming today and sharing everything you've shared.
And
Well,
likewise, and some of the initiatives are just incredible. And I mean, losing a man at the very start, I was like,
Yeah.
oh God, what does that mean? And it's just phenomenal. It's
Yeah.
it's really strong.
Yeah, I think if you can give them, actually part of the Gutbuster program, we did a documentary on it. We got students from Dunleary Film College to come in and film it, and I measured all the inches, and actually it nearly came to the circumference of a double-decker bus. So they could relate. The language was related. They could kind of understand. But I think that's what you can personalize it into your company and weave it in with what whatever the product is. It makes sense then.
Yeah, I love it.
Is there a difference on, between, kind of crudely speaking, trades and professional employees in terms of take up and approach and all that?
Yeah, definitely. The more managerial, the white collar worker will engage more because a lot of our stuff now is web based since COVID, and we're going to get I know I'm going to get higher engagement now because we're launching a program. So we still have a challenge in getting the blue collar worker.
Yeah.
So I would, like, traditionally I would have gone out to them. So, but there's only one of me. But I know when I do go out to the workshop, and I'm in the company about 18 years in the CIE group, so they know me and trust me. But that's taken years to develop. And I would have employed students to help me as well, from colleges, health promotion students or nursing or physical activity students. So that's another area of, where you can get in. I want to develop more internships around wellbeing and grow that. But you do need definitely for the blue collar workers, you need to be going into their workshops and into their canteens and just plonking yourself down at the table with them, and that definitely works, I know. But just some of the web-based stuff it's not the same. You don't get the same engagement, and the men's development work with the Engage program, they've tried to move it online, but a lot is lost because we know ourselves, you feel an energy in the room and you can read the body a lot better. Whereas I'm just seeing heads here now and it's not the same, because with communication, the words are only 7%, whereas you can feel the body language, you can feel the tone of the voice. There's a lot of things are missing online, that we're all missing, So please God, it'll come back.
So I don't want
I
to
think-
end. Sorry, I don't want to end this discussion. So I've got this recording and it's set up automatically, Anne.
Okay.
So I'm going to step off, but when you leave, it'll all be saved to the cloud. So don't worry.
Yeah.
I just don't want to end the conversation too much. Thank you so much for today. Gosh, there's so much in there for thought. Thank you.
No worries. So thanks a lot, Seamus. And if there's nothing else, or even just send me an email if or you'd like to talk to me on a one-to-one.
I think Linda might have a question. I'm not sure, Linda, did you have a question?
Yeah, no, it was actually I'm very, very, very sorry that I came in so late. I got caught on a call that I wasn't supposed to be on, but what I did come in and hear is fascinating. And I was actually going to ask if there is a recording that I could access to catch the beginning of it. So Louise has just said that she's recorded.
Yeah.
So will I be able to get it or?
No, we will. We'll share it on afterwards.
Fantastic. Thank
Sorry,
you.
Jen.
Yeah, it's Linda, what will happen in the future is that you'll be able to access all recorded events on the event website. So I'll shoot you a message later and you'll be able to find it once it comes up. But yeah, and I wanted to say as well, I took down so many notes and it's just super interesting to get the perspective from experience. And I think one of the questions is, what is the type of language? Because you gave a few examples, but do you have just a few more examples on what is specific language that you find that works really well so far to engagement in initiatives that you're launching new, I suppose?
Yeah, well, I suppose over the years, say if I was talking to a man around his cholesterol was high, I'd say around, you need to put good oil in your engine. If you're going to put crap stuff, your engine's going to burn out. So I kind of always use the analogy of cars and engines, and they relate to that, especially the mechanics. Yeah, and I think, you know, you find out, like when I'm health coaching men, you know, when you do the Wheel of Life, you get them to fill out all the components that are important to them, and also around what they value. So, you know, if you meet a guy, he doesn't put health on his life wheel, but he might put family, or he might put other. So you kind of say to them, you know, well, what would it mean, you know, for your family if you didn't look after your health? You know, and that makes them think, because that's the hook is their family, or they want to walk their daughter down the aisle, or they want to play with their grandchildren. So, you know, that's and for us all as well, but I think for men even more so. If you can find out, I had one guy, I remember, come into my office, and all he wanted to do was talk about, he was very overweight. I got a referral from one of the doctors, but he was passionate about bees and forests, and we talked just about bees for the first session. But what hooked him to losing weight was that the lighter he was, he could move his bee colonies around, and you know, he was more able for the work in his allotment, and you know, that made sense to him. We're all very different, not one size fits all. But it's, you know, like if you're looking at a group of drivers, you know, what is the language that would appeal to them, you know, and you have to really listen. There's such a thing as called clean language, and you play back their words to them, and it lands with them. It makes sense, because when, you know, I've seen thousands of life wheels around the place, and you know, and then you have the language from the person, and that, you know, that connects and builds rapport more. But I remember doing a life wheel with a doctor, and she was talking about psychological safety, and she had all the big words, because she had that, you know. But if I talked about like words like psychology and stuff that to some of these guys, they wouldn't understand it. So you have to really do meet them where they're at, and just I think being honest as well is important. Yeah.
Can I ask you, please? I was really interested about what you mentioned about Leia Health, the Leia Health app, and then in turn you've talked about Spectrum Life.
Yeah.
Was there a difference in the take-up with Spectrum Life, considering it's not a healthcare company or a brand that's out there?
Unfortunately, we're just launching the Spectrum Life one with Irish Rail at the end of this month. We're doing a 3-month program with them. So it'll be interesting to see the engagement stats when it's over. But yeah, I suppose you know, it was just learning for me that if you bring in a health insurance company, you know, that there was issues around that. But I find there's very good engagement when you bring in someone like from the Irish Cancer Society, or, you know, Aware, because they're kind of standalone, you know, and they're respected. So, you know, but there's lots of organizations out there, and it is worth, you know, for, you know, free, or, you know, there's a small fee that you can get them to be part of a kind of a wellness strategy as well. But there's another thing as well worth considering. It's called the Well Hub, and that's an IT platform. It's from a guy called Ken Alderley, and he has done a lot of research in employee engagement. And the Well Hub is like an IT platform that keeps the partnerships with all of the organizations that you're interested in, and keeps everything up to date. Like last week was Women's International Day, so they'd have that on the platform, or, you know, but it saves you having to pay someone to do it. They keep it up to date themselves. So that's just another good resource. So we would have, like in Dublin Bus, they have a Well Hub, and their partnership with the Men's Health Forum, you know, I suppose all the different male-related areas of interest as well. So yeah, so you could go on and on about this topic.
Thanks, Anne, very much. I've got to run, collect some kids. So
yeah, no worries. Thanks for staying on.
Not at all. Thank you.
Yeah. So no, it's a great thing. And who else did you have for the month of March?
We had Frank Dillon. We had a couple of the members as well. Stephen here, who was on the call, spoke last week. Last week, I had a session. So it's mainly members who are coming in, but we have guests like yourself, Anne, from, you know, with practical experience in industry. Like, we all do ourselves as well, obviously, but who are not necessarily members of Ireland Together. And then with Frank Dillon from Men's Sheds. So we're going to continue. We have Owen actually who's just left, who's doing a session later on in the week about increasing, it was boosting energy and managing stress. And then towards the end of next week, it's actually psychological safety. We're going to finish off with next week from another
Brilliant.
So it's really, really nice mix, yeah.
Yeah, yous are full on.
Yeah, oh no, it's really, really been a great month.
Yeah,
And
yeah.
and it's great to have it recorded as well.
Yeah, you have it as a
Yeah.
resource then.
And
Yeah.
just thank you
Thanks
so
very
much.
much.
Yeah,
It was
okay.
really, really insightful. Just wondering, are you happy to share that presentation at all? Because I think there's a huge amount of resources there that can be very useful.
Yeah,
But
that's
if you're
fine.
happy to share.
Yeah, no, that's fine. Yeah, no, that's grand. Yeah. I hope I'm doing not too many ams and ahs.
No, it's brilliant. No, really,
Yeah.
it was amazing. And thanks so
Yeah.
much for all the prep and for, really insightful session.
Okay. Look, guys, I'll let you go then. Have a nice afternoon. And
Take care. Thanks again.
Thanks so much.
See you guys.
Have a lovely
Bye-bye.
day. Bye. Bye.
Bye.